Hi, I'm Dr. Murphy Mastin, and I'm a board-certified dermatologist at CMH Dermatology Clinic in Bolivar, Missouri. So I would say that you should use sunscreen like you use toothpaste as a preventative and at least twice a day, but ultimately the recommendation is an SPF 30 or higher, reapplied every few hours, ultimately because it degrades and loses its ability to protect yourself from the sun. I would also say that the key things to take into consideration are the peak hours of the sun. So you want to stay out of the sun between 10 a.m. and 2 p.m. The other things I would also say are wearing sun protective clothing. This type of clothing has come down significantly in price, and it's woven with specific materials and in a certain fashion to provide significant sun protection. Oftentimes it's actually labeled as UPF, and I once again would recommend at least a 30 UPF clothing as well. With the regular use of SPF 15 or higher, the risk for melanoma decreases by about 50%, whereas squamous cell carcinoma and basal cell carcinoma risk, if SPF 15 or higher is reapplied regularly, decreases by about 40%. So it can significantly reduce your risk for developing skin cancers. You can develop skin damage from sunlight at all times of the year, whether it's through a window or shades, or even a cotton t-shirt. It doesn't provide significant sun protection. Ultimately, there may be lower UV radiation levels from the sun during fall or winter, but ultimately you still develop sun damage, and actually 80% of aging is sun-related damage that you're actually seeing. And we're seeing higher levels of that at earlier ages. And I'm not sure if it's people spending more time in the sun. Somebody may have been more covered back in the early 1900s than the clothing that we wear today. Possibly effects on the ozone and the ability for that to protect us from UV radiation. Possibly there are other factors at play, but we're still researching that. There are certain steps that one can take to assist with treating sun damage, but the key thing would be to prevent it from starting in the first place. When you see wrinkles or you see discoloration of the skin or skin cancers, there are certain procedures or medications that we can consider using, but all of these have possible side effects, and it's much easier to prevent than try to treat. So ultimately, the things that would indicate sun damage on the skin would be sunspots like freckles, wrinkles. Ultimately, sunlight destroys the main protein in the skin called collagen that provides structural support and the smooth texture of our skin. And we ultimately discontinue making collagen after 18 years of age, and it decreases by about 1% per year. And that can be accelerated by sun exposure. The other things that you might see would be scaly red spots called precancers or actinic keratoses, and that's a common sign of sun damage as well that I see, and that does have the risk of becoming squamous cell carcinoma. Those would be the key things that I would look for. I would recommend wearing sunscreen 30 SPF or higher every day and reapplying every few hours. I would encourage anybody with skincare concerns to reach out to us at CMH Dermatology Clinic in Bolivar, Missouri. We're trained and capable of handling complex medical dermatology, including rashes. We specialize in skin cancer, screenings and evaluations and management. If you have any concerns, you can contact us as stated at 417-328-4500, or you can reach out to your local primary provider or physician for a referral.